Hi, I'm Dr. Ramsey Choucair, a board-certified plastic surgeon with over 20 years of experience in facial rejuvenation surgery. Today, I want to address a common concern, the anxiety that patients feel before undergoing facial cosmetic surgery. Certainly perfectly normal to have those fears, but understanding the process can hopefully help someone become more confident in their decision. But anxiety before surgery, especially elective facial surgery, is a normal response. It's not being anxious that's not really normal. So I hear these concerns all the time. Will I look unnatural or pulled? What will my family or friends think? They think I look good already. Will I be in pain? Is it really safe to do elective cosmetic facial surgery? Will I look different or weird or not myself? All valid questions. First, let's talk about the fear of looking unnatural or pulled. Modern facelift techniques using the deep tissue, the SMAS or deep plane, focus on creating natural results by not pulling on the skin too tight. And it's not rocket science to have someone look natural after a facelift. It's very achievable. Correct vector or direction of lift to avoid the windblown look is one of the primary important aspects. Gentle handling of the tissues, paying attention to all the details, and just applying the right amount of tension to avoid the too tight look. You have to balance the redraping or the lifting of the skin with what I call age-appropriate volume, because certainly over-volume in the face is noticeable. So these are the things: preserving hairlines, repositioning the earlobes in their proper position. Simply put, they avoid all the telltale signs of surgery. And using advanced suture techniques and meticulous attention to details, which is emphasized over and over, creates results that make almost undetectable scars. Next, let's address the fear of pain. In my practice, patients often tell me that their recovery was much easier than expected. Not surprising, because most people are very anxious about surgery. Most discomfort is managed with over-the-counter medications like Tylenol. We do give stronger medication if necessary. And of course, the long-acting local anesthetics that we inject at the end of the surgery help patients in the early post-operative phase. Most patients sense a bit of tightness or mild soreness, but not severe pain. Facelifts in general are just not significantly painful. Now, safety is a priority, and with appropriate care, facelift surgery is very safe. Performed by board-certified plastic surgeons who've done thorough preoperative evaluation of your health in an accredited operating room, a certified surgical facility, and done with anesthesiologists who are board-certified, who are with you to monitor you the entire process. And then, of course, diligent aftercare by experienced nurses and direct access to your surgeon, which I think is most valuable in any post-operative care. Complications are rare. They're usually minimal if they occur and very manageable. So facelifts have an excellent safety profile as long as you follow all the precise details that surgeons know to follow. Finally, let's talk about scarring. One of the biggest misconceptions is that a facelift will leave you with obvious, highly visible scars. The truth is that with thoughtfully planned incisions, by preserving natural hairlines, making sure the earlobes go back where they're supposed to be so they're not pulled down, with performing great precision with the surgery and gentle tissue handling, which is so important, facelift incisions heal remarkably well and hardly detectable in almost all cases. Incisions placed in natural creases around the ear and at the edge of the hairline, where they become virtually invisible over time, are our goal. And here's an example of a facelift after 7 years showing the improvement in the neck, and especially with the looking down view, which really shows the value of the facelift and the longevity. Because the looking down view is what you see when you're on the dinner table, it's what you see when you're looking at your phone, and it's the view that many surgeons don't show because you have to really move the skin in the proper direction to show a normal looking down view after surgery. So here she is before, and after you can hardly see any incisions because they're well hidden, and that's the goal. In the end, everyone desires to look as good as they feel. That's one of the primary reasons that individuals seek out facial rejuvenation, and it's a personal choice. An expertly performed facelift can transform patients, boost their self-confidence and their quality of life. If you're considering this journey, I encourage you to consult with an experienced board-certified plastic surgeon who specializes in facial rejuvenation. Thank you for watching.